Good day, this is Gabriel Angelo Villawan, and this presentation is a requirement for microteaching that explores the germ theory of diseases. Now, let's get started. Now, these are the lesson contents of the presentation, starting from defining the germ theory of diseases, its early development, applications on different fields of science, and including Koch postulates. So, what is the germ theory of diseases? In the world of medicine, this theory tells a story about how certain diseases are caused by microorganisms reproducing inside the host, such as humans, and are usually seen through the lens of a microscope. Before it became beneficial to our society, people of the 17th century believed that diseases were attributed to mystical entities such as bad air or miasma, emanating from decomposing matter, sewage, and cesspits. Diseases such as the Black Death, which ravaged the Europe's population during the Middle Ages, were thought to have originated in this way. The early proponents of the germ theory of diseases include Girolamo Fracastoro, an Italian physician that proposed in his essay entitled The Contagioni et Contagiosus Morbis that tells about how seed-like spores may be transferred between individuals through direct contact, contaminated clothing, and the air. However, in the 16th century, Fracastoro's ideas were not widely accepted and would be largely forgotten until the 19th century. Another proponent is Ignaz Semmelweis, a Hungarian physician who discovered the cause of puerperal fever and introduced antisepsis into medical practice. He observed the high mortality rate of mothers who gave birth in hospital wards staffed by physicians and medical students compared to those who are staffed by midwives, which only have 1% mortality rate. The reason for this is that medical students performing on autopsies also carry out vaginal examination on living patients without washing their hands in between. He suspected that the students carried the diseases from the cadavers to the patients. This suspicion was supported by the death of his friend who contracted a fatal wound infection parallel to the cause of death of his patient who died of puerperal infection. Although Semmelweis did not know the true cause of puerperal fever, he proposed that physicians were somehow transferring this causative agent to their patients. He suggested the number of cases could be reduced if they would simply wash their hands with chlorinated lime water before and after examining every patient. When this practice was implemented, the maternal mortality rate in mothers dropped in the same 1% mortality rate observed among mothers cared by midwives. In 1948, the miasma theory was disproved by the work of Ignaz Semmelweis and John Snow on the cholera outbreaks in London. People at that time associated these infections with miasma, but John Snow conducted studies to track the source of these outbreaks by tracing specific water sources that were contaminated by sewage. This demonstrates that the cholera outbreak was transmitted via water and not through miasma. This was an important in the progress of the germ theory of diseases as well as in epidemiology. Even though Semmelweis and Snow's research effectively demonstrated the need for sanitation in preventing infectious diseases, the exact cause of the illness was still unknown. Louis Pasteur, Robert Koch, and Joseph Lister's subsequent studies would support the germ theory of disease even more. The foundation for the germ theory of disease was demonstrated by Louis Pasteur in a swan-neck flask experiment wherein airborne microbes cause food spoilage and fermentation, which disproves the spontaneous generation that tells about how life arises from non-living matter. Another contributor to this theory is the British surgeon Joseph Lister, who applied the work of Semmelweis and Pasteur on sanitation. during surgery to reduce the incidence of post-surgical wound infections. In 1867, to further decrease the incidence of these infections, Lister began using carbolic acid or phenol spray as a disinfectant or antiseptic during surgery. His extremely successful efforts to reduce post-surgical infection caused his techniques to become a standard medical practice. Another prominent figure is Robert Koch, who proposed a series of postulates based on the idea that the cause of a specific disease could be attributed to a specific microbe. He provided a systematic framework for establishing the causal relationship between a microorganism and a disease. His postulates are as follows. First is that the microorganism must be present in every case of the disease but absent from healthy organisms. Then the microorganism must be isolated and grown in a pure culture. The cultured microorganism should cause disease when introduced into a healthy organism. The microorganism must be re-isolated from the inoculated disease experimental host and identified as identical to the original specific causative agent. Koch and his colleagues were able to definitively identify the causative pathogens of specific diseases, including anthrax, tuberculosis, and cholera. These postulates serves as a cornerstone in microbiology and epidemiology, providing a standardized method for identifying the etiological agents of infectious diseases. These are the references, and that is the end of presentation. Thank you so much.